Phonological processes therapy. This type of therapy is used for children who present with a limited number of phonological processes. Make sure to choose sound errors that occur most frequently in the child's repertoire. The child should be stimulable for the target sounds presented.
A child who would benefit from phonological process therapy is 4 to 5 years old who presents with mild phonological process disorder and has a limited number of phonological processes.
Components of a comprehensive assessment include the following: case history or interview, hearing screening, oral motor exam, articulation test, phonology test, stimulability testing, contextual testing, measure intelligibility and severity, language sample, voice screening, fluency screening, and literacy screening.
In order to obtain a child's phonetic and phonemic inventory, the Goldman-Fristow test of articulation and the Kahn-Lewis phonological analysis should be given. The completion of these tests will better determine which sounds to baseline.
We will be obtaining baseline data for final consonant deletion. First, we must discover the child's errors based on the results from the Goldman-Fristow and Kahn-Lewis. We will use the train activity in order to do this. Correct productions out of 10 opportunities will be recorded. If the child produces a final consonant, it will be marked correct even if it is not the correct ending sound. If the child deletes the final consonant, the production will be marked incorrect. A percentage will be obtained from correct utterances out of the total possible number of utterances. Okay, Jamie, I have an engine sound here and a caboose sound here. I want you to put the two sounds together and read the word for me.
B.
Jamie got this word incorrect because it has the first word be, which she said, but it also has a P at the end, which she forgot. She deleted the final consonant. I marked it incorrect on my score sheet because she did not get the word correct.
Target sounds should be chosen based on effects on intelligibility. Our client would focus on final consonant deletion because the processes affect the child's intelligibility. Based on the results from the Goldman-Fristow test of articulation and the Kahn-Lewis phonological analysis, the child presented with the phonological process of final consonant deletion, so therapy should be directed towards final consonant deletion in single-syllable words.
For our therapy approach, we will first teach the contrast of meaning between the words. The clinician will ask the child to point to the appropriate picture in response to the statements and questions that illustrate the meaning of the word. Second, we will have the child point to the words when they are named. Lastly, we will have the child produce the target words with the final consonants. Hi Jamie, how are you today?
I'm good.
Good. Today we're going to be working on the end sounds of words. This is a picture of a bee. Can you say the word bee?
B.
Very good. This is a picture of a car and it says beep. Can you say beep?
Beep.
Did you hear the p at the end of that word? Good. So I want you to point to the picture of bee. Good job. Now point to the picture of beep. Very good. Now I'm going to mix them up. Now point to the picture of beep. Good job. Point to the picture of beep. Very good. Now point to the picture of bee. Yay! High five. Now I'm going to let you be the teacher and I'm going to have to answer your questions. Now ask me a question about both of these pictures.
Point to the one that says B. Good. Point to the picture of beep.
I heard that on that beep word. That's very good, Jamie. The two advantages of this approach are as follows. It is efficient and quick to teach, and it focuses on transforming the child's language into a more adult-like form. The disadvantages are as follows. It cannot be used for a child with severe phonological disorder, and it is only used for children with mild or limited phonological processes. Only a small age group of children are able to benefit from this therapy approach, and children must be attentive to this activity.